Aripiprazole represents a significant advancement in the treatment of various psychiatric conditions, marking a pivotal moment in the evolution of antipsychotic medications. Its development was driven by the quest for more effective treatments with fewer side effects, a common limitation among traditional antipsychotic drugs. As a novel, atypical antipsychotic, aripiprazole exhibits a unique mechanism of action, distinguishing it from its predecessors and providing a new avenue for therapy. The inception of aripiprazole into the psychiatric medication landscape has been met with both enthusiasm and scrutiny. Its effectiveness across a spectrum of disorders has been a subject of numerous studies, aiming to understand its full potential and limitations. This has led to a broadening of its applications, making it a versatile tool in the psychiatrist's arsenal. Understanding what aripiprazole is used for involves delving into its pharmacological profile, exploring its benefits, and acknowledging its side effects and potential hazards. This comprehensive approach allows patients and healthcare providers to make informed decisions, tailoring treatment plans to meet individual needs while minimizing risks. Usual applications of aripiprazole. Aripiprazole's approval by regulatory agencies was a landmark event in psychiatric care, heralding its introduction for the management of several conditions. Primarily, it is employed in the treatment of schizophrenia, a complex mental disorder characterized by distorted thoughts, perceptions, and emotions. Aripiprazole's efficacy in alleviating both positive and negative symptoms has been a source of hope for many affected individuals. Beyond schizophrenia, aripiprazole has found utility in managing bipolar disorder, particularly in stabilizing mood swings and preventing manic episodes. Its ability to mitigate the extremes of bipolar disorder without inducing the sedation often associated with other treatments has been particularly valued. Additionally, aripiprazole is prescribed for augmenting the treatment of major depressive disorder when initial therapies do not yield sufficient improvement. Its role in this context underscores the medication's versatility and the ongoing exploration of its full therapeutic potential. Advantages of using aripiprazole. The distinctive benefits of aripiprazole stem from its pharmacodynamic properties, which confer several advantages over traditional antipsychotics. Its unique action as a dopamine system stabilizer allows it to modulate neurotransmitter activity without the profound suppression typical of other medications. This results in a lower incidence of side effects such as extrapyramidal symptoms, which include tremors and involuntary movements, thereby enhancing patient compliance and quality of life. Furthermore, aripiprazole's efficacy in treating a range of psychiatric conditions without causing significant weight gain, a common drawback of many antipsychotic drugs, marks a significant improvement in managing long-term health risks associated with obesity and metabolic syndrome. The medication's profile is complemented by its relatively benign side effect profile, making it a more appealing option for long-term therapy. This balance between effectiveness and tolerability is a cornerstone of aripiprazole's advantages, facilitating its integration into comprehensive treatment plans. Potential side effects of aripiprazole. While aripiprazole's side effects are generally less severe than those of traditional antipsychotics, they warrant attention and management. Common adverse effects include headache, anxiety, insomnia, and gastrointestinal disturbances, which are typically mild and transient. However, awareness and monitoring are essential, as individual responses to the medication can vary. More serious concerns involve the risk of akathisia, characterized by an inner sense of restlessness and the need to move constantly. This condition can be distressing and may require adjustment of the treatment regimen. Additionally, although rare, aripiprazole can induce neuroleptic malignant syndrome, a serious condition marked by fever, muscle rigidity, and altered mental status, necessitating immediate medical intervention. The potential for aripiprazole to affect metabolic parameters, such as blood sugar and lipid levels, although lower than with other antipsychotics, underscores the need for comprehensive care and regular health monitoring during treatment. Dosage recommendations for aripiprazole. Determining the optimal dosage of aripiprazole is a critical aspect of treatment, tailored to the individual's condition, response to the medication, and tolerance of its effects. The dosing regimen usually begins with a lower amount, gradually increasing to achieve the desired therapeutic outcome while minimizing side effects. For schizophrenia and bipolar disorder, the initial dosages and adjustments are guided by clinical guidelines and patient response. In the context of depression augmentation, aripiprazole is prescribed at lower doses, reflecting its role as an adjunctive treatment. It is imperative for patients to adhere to the prescribed dosage and not to alter the regimen without consulting their healthcare provider. Regular follow-ups are essential to assess the medication's efficacy and adjust the dosage as needed, ensuring optimal outcomes. Hazards and precautions associated with aripiprazole. The use of aripiprazole, like any medication, involves consideration of potential hazards and the implementation of precautions to mitigate risks. Patients with a history of hypersensitivity to aripiprazole or its components should avoid its use. Caution is also advised in individuals with cardiovascular disorders, seizure disorders, and those at risk of suicide, reflecting the need for a careful assessment of the benefits and risks. The potential for aripiprazole to impair judgment, thinking, or motor skills highlights the importance of advising patients against operating heavy machinery or engaging in activities requiring mental alertness until they are familiar with the medication's effects on their body. Pregnant or breastfeeding women should discuss the use of aripiprazole with their healthcare provider, considering the potential risks and benefits to both the mother and the child. This careful consideration ensures that treatment decisions are made in the best interest of both parties. Aripiprazole versus other antipsychotic medications. Comparing aripiprazole with other antipsychotic medications illuminates its unique position in the treatment landscape. Its mechanism of action as a partial agonist at dopamine and serotonin receptors provides a therapeutic effect with a reduced side effect profile, particularly in terms of extrapyramidal symptoms and metabolic effects. This comparison reveals the importance of selecting a medication based on the individual's specific needs, health status, and potential for side effects. Aripiprazole's favorable profile makes it a preferred option for many patients, especially those who have experienced adverse effects with other antipsychotics. The choice between aripiprazole and other medications ultimately rests on a thorough evaluation of the patient's condition, treatment history, and personal preferences, guided by the expertise of the healthcare provider. Aripiprazole in combination with other medications. In certain cases, aripiprazole is used in combination with other medications to enhance therapeutic outcomes. This approach is particularly prevalent in the treatment of major depressive disorder, where aripiprazole can be added to existing antidepressant therapy to augment its effect. County administration with other drugs requires careful consideration of potential interactions that could affect the efficacy or increase the risk of adverse effects. Monitoring and adjusting the dosages of the involved medications are critical steps in managing these combinations effectively. This strategy exemplifies the personalized nature of psychiatric treatment, where the goal is to construct a regimen that addresses the specific needs and circumstances of each patient, optimizing the benefits while minimizing risks. Aripiprazole for different age groups. The application of aripiprazole across different age groups underscores its versatility. In adults, it is widely used for treating schizophrenia, bipolar disorder, and as an adjunct for major depressive disorder. Its use in adolescents, particularly for schizophrenia and bipolar mania, is supported by evidence demonstrating its safety and efficacy in this population. However, the treatment of pediatric patients requires a nuanced approach, considering the developmental implications and the long-term effects of antipsychotic medications. The decision to prescribe aripiprazole for children is made with caution, involving a comprehensive evaluation and the informed consent of guardians. Understanding the distinct considerations for each age group ensures that aripiprazole is used appropriately, maximizing its benefits while safeguarding against potential risks. Conclusion: understanding the applications and considerations of aripiprazole. Aripiprazole stands as a pivotal development in psychiatric medication, offering a blend of efficacy and a manageable side effect profile. Its applications across a range of psychiatric conditions, from schizophrenia to bipolar disorder and major depressive disorder, reflect its versatility and importance in modern therapy. Embracing the advantages of aripiprazole while being mindful of its potential side effects and hazards ensures its optimal use. Tailoring treatment to the individual, considering the unique aspects of their condition and their response to medication, is the foundation of effective psychiatric care. Through careful selection, dosing, and monitoring, aripiprazole can significantly improve the quality of life for many individuals, illustrating the progress and potential of psychiatric treatment. As we continue to explore and understand its full capabilities, aripiprazole will undoubtedly remain a key component of psychiatric therapy, embodying the ongoing evolution of medication in the pursuit of mental health and well-being.